In July 2014, a man arrived in Lagos, Nigeria. His name was Patrick Sawyer, a Liberian American. He had come to attend a conference. But what no one knew was that Patrick was very sick. He was carrying a deadly virus called Ebola. At the Murtala Muhammad International Airport, Patrick collapsed. He was taken to First Consultant Medical Center in Obalende. The doctors there were worried. His symptoms, fever, vomiting, weakness, were dangerous. But they didn't know it was Ebola yet. Dr. Ameyo Stella Adadevoh, a brave and wise doctor, noticed something strange. She looked closely at Patrick's travel history and symptoms. She had a feeling it was Ebola. Even though Patrick demanded to be released, Dr. Adadevoh refused. She put him in isolation. Her decision saved many lives. Some hospital workers disagreed. They were afraid and confused. But Dr. Adadevoh stood firm. She even contacted the Nigerian Ministry of Health. Sadly, Patrick Sawyer died. But before he did, a few people who took care of him got infected too. News spread quickly. Lagos, with over 20 million people, was at great risk. Panic began to grow, but Nigeria acted fast. The federal government of Nigeria, with help from the Nigerian Center for Disease Control, NCDC, and Lagos State Government, set up an Emergency Operations Center, EOC. Experts from the World Health Organization, WHO, Doctors Without Borders, MSF, and the U.S. Centers for Disease Control, CDC, also joined in. Key people in the fight included Dr. Faisal Shuaib, head of the Ebola Emergency Operations Center, Dr. Abdul Salami Nasidi, head of the NCDC, Dr. Chikwe Ihekweazu, epidemiologist and future NCDC director, Professor Onyebuchi Chukwu, Nigeria's Minister of Health at the time, Governor Babatunde Fashola, Lagos State Governor. They formed a strong team. Their goal, stop Ebola from spreading. Every day, the team worked long hours. They began contact tracing, finding everyone who had contact with Patrick Sawyer and others who were infected. In total, 894 contacts were traced and monitored. Health workers visited them every day for 21 days to check for symptoms. Treatment centers were quickly built. Isolation wards were set up. Public awareness campaigns began on radio, TV, and in markets. People were taught how Ebola spreads and how to protect themselves, wash hands, avoid body contact, report symptoms. Health workers wore protective suits, gloves, and masks. Some Nigerians were scared, others believed false rumors, but the truth began to spread. Sadly, Dr. Adadevoh and some of her colleagues got infected. Despite the best care, she died. Nigeria mourned her. She became a national hero. Weeks passed. Infected patients were treated. Some recovered, others did not, but new cases became fewer. By October 20th, 2014, the World Health Organization declared Nigeria Ebola-free. Only 20 people were infected. 8 people died. Compared to other countries like Liberia and Sierra Leone, Nigeria had done an amazing job. The world praised Nigeria's quick action, brave doctors, and strong teamwork. The Ebola fight changed Nigeria. It showed that with good planning and brave people, any problem can be faced. Hospitals improved their emergency systems. People became more aware of hygiene and public health. Dr. Ameyo Stella Adadevoh's name lives on. A foundation was created in her honor, the doctor. Ameyo Stella Adadevoh, DRASA, Health Trust, to promote disease prevention and public health education. Many students now learn about her in school. Her story is told again and again, not just as a doctor, but as a hero who stood in the gap when Nigeria needed her most.